Hi, welcome to Cancer Tamer. I'm Dr. Charley Ferrer, and I'm your host. Today, I have a special guest with us. Her name is Tammy Kohlschmidt. She actually is a certified clinical thermographer, and we'll tell you what that is. She was actually the one that made the connection between your body and your mouth, and how those two entities play into illness as well as wellness. And so welcome, Tammy.
Thank you, Dr. Charley.
So tell us a little bit about what thermography is.
Okay, so thermography is it's digital infrared imaging. So I use a camera that we take pictures of your body, and what we're looking for is temperature. So it's like infrared heat that's coming off of your body. That's what the camera is measuring. You're going to see a lot of different colors when you see the images, everything from white, which is the hottest, to black, which is the coldest. And then there's all different colors in between.
And so for those that don't know it, we're going to have some pictures too that we're going to be showing you. And so it's like we see in those new sci-fi movies where they're looking through their scope and they're seeing, and all you see is the little red images walking through, and that's basically what we're looking for, right?
Yep.
It's the heat stuff.
I actually thought it would be the red that was inflamed, but you're saying it's the white.
It is also the red, but white's the hottest.
Oh, okay.
So red would be second.
So why is it important to know the difference of our temperature? I mean, we're all like, what is it, 97.8 or 97.9, and
right.
So why should we care that there's a different temperature?
So one of the things that I always say is thermal imaging allows you to see what you may not yet feel. So you don't feel inflammation brewing within your body until it comes to a point where it becomes an actual physical symptom or a sign of illness. So this is a way to catch things very early. And your temperature reflects nerve issues that you may not even know you have. It reflects hormonal imbalance. It reflects lymphatic stagnation, digestive stagnation, inflammation in general. But everything that is underlying all of that brings us to toxicity, which is really the undercurrent that causes the inflammation in the first place. So all of those things can be detected, and you need to know that in order to be healthy.
And where does the toxicity come from?
Good question. So it comes from the air we breathe, the water we drink, the food we eat, and our thoughts. So
And our thoughts?
Our thoughts. A lot of people have a lot of toxic thoughts, and it causes a lot of internal stress, which raises up your internal heat, your temperature. It actually will cause the muscles to contract or spasm. You know, a lot of times we'll say, oh, it's a pain in the neck. That's the spasm. That can come from your thoughts.
And that's what we call in psychology somatic disease and somatic symptoms, because it's your body is connecting. So what you tell what your mind tells your body, it believes.
Yes.
And so if you believe you can pick up this car, you will pick it up.
You will.
And that's why, I talk a lot about the Cancer Tamer philosophy and the fact that it's not about fighting, it's not about surviving, it's not about being in battle with cancer, because everybody thinks that cancer is like this force out here that we have to do fights with, but it's not. It's an internal thing. So cancer's in your blood, cancer's in your bones, it's in your body, it's in different parts of your body. And so if you're constantly thinking, hey, I got to destroy this, then you're destroying yourself.
Yeah.
And so, I love the fact that you're bringing in what we think is also so important.
It is.
And I want to look at one of the pictures that you brought in. I don't know if you can pick this up, but can you tell us a little bit about what's going on in this picture?
Sure.
And what we're seeing here? And this is a picture of someone's breast. Is that correct?
Correct. So one of the things about when you do thermal imaging is we're looking at your body's temperature. You want the temperature to be even and symmetrical on both sides of the body. And you also are, when we read these images, we're also looking at patterns. So we have temperature and we have patterns. This particular image, does show breast cancer, and that would be,
Is this,
yeah,
these,
that would be the red around the nipple and also the red that trails up towards the top of the breast.
so this way?
Follow that line, yeah.
Okay.
So that, all of that area is cancerous and inflammatory. If you notice the other breast, the left breast, it's green and blue. Those are the healthy colors. That's a cool system. And you're going to find certain areas that have more heat, but you really want more of a cooler temperature, and you want that to be symmetrical in both breasts.
Okay, and what about here, down here, because I'm seeing red here and I'm seeing red up here. Is this like where your lymph nodes are, and so they're,
Yeah,
so maybe there might be an issue here or something?
well, usually when the lymph is stagnated, that's a disease process in itself. You're already holding toxins because your lymph system is your garbage disposal system. So if the lymph is stagnated, if it's not moving, toxins are trapped. So you can see around her throat and in the neck area, that white and red heat, that's all stagnated lymph. In the armpits, the red, the heat, that's stagnated lymph.
So all this up here
And into the armpit.
and into the armpit. Well, the other
More over
armpit
here.
where-
Yeah.
I
Yeah.
forget that on camera everything is backwards.
Right. Now, you will see some heat under the breast line just because it's natural body heat. So especially with women who have larger breasts, you're going to have more of a heat pattern under there. One of the main things, though, is when you wear bras that are really tight or have an underwire, that's when this becomes an issue because that becomes
right here.
stagnated lymph. So if your lymph is stagnated, then your breast tissue is building heat, which is building acid, which is holding in toxins. So the less you wear a bra, the better. It just
Ladies, burn your
true.
bras.
Yeah, really.
But you also, I remember that you had said there's a massage. There's a
Yes.
certain massage that you do
Yeah.
for helping to move things around
Right.
and such. Can you
Sure.
show us a little bit of that?
So my advice is you can choose when you want to do this. You're either going to do it while you're in the shower or when you change into your night clothes. So you take your bra off and you just literally move your breasts in circles. You move them outward, like outward towards your armpit, inward, and then you bounce them up and down like if you were on a trampoline.
So ladies,
That moves
you
your
are
lymph.
getting education on how to play with your breasts.
Yeah.
Yes, a girl like
so it
this.
is important for you
Every
to
day.
touch yourself every day. You know, we have that
Right.
old idea that we're not supposed to touch our bodies. And I always tell people, it's your body. You know, you're allowed to touch it however you want. And so it's wonderful.
Yeah.
I mean, Tammy's giving us permission
That's right.
permission to touch your body and to make it healthy.
Yeah.
And
Drain the
it's
lymph.
also so important too because that's how you can find any lumps or any abnormalities. I mean, I found my own. I found the cancer myself.
Right.
Because I was doing my own breast exam. And,
Every woman should do that.
and everyone should do that.
Yes.
And in one of our shows, we actually, Deborah and I got together and we were talking about how to do a breast exam.
That's right.
And so we did that in one of our shows, and we'll repeat that, you know,
Again,
sporadically.
definitely.
Yeah.
That's
Because we
true.
want everyone, and men too, right? So I mean, this
Absolutely.
is true
Yeah.
for men as well,
'Cause-
isn't
right,
it?
Yeah.
men have breast cancer, so that's a
Yeah.
definite on that. What I did want to ask though, when it comes to the massage, are you talking about massage before somebody is diagnosed with something?
You should do this.
Like
this should
even
be
after?
taught. The minute a woman or a young girl is told to wear a bra, she should be taught how to massage her breasts.
Okay.
A self breast exam is different than a massage because the self breast exam is something you start to do like once a month routinely. You get to know, your body. The massage is done daily for, 30 to 60 seconds, just so you're draining your lymph. And as you do that, you do get to know your breasts. I mean, you get to really feel like what feels right. So our young girls need to do this.
So you're detecting things, and you're building a comfort with your body.
You're
I think
massaging,
there's so much out there, and we're taught to hate our bodies, and then we wonder why we have a problem. And I say we're taught to hate our bodies because you're not supposed to touch it, you're not supposed to play with it, you're not
It's
supposed
supposed to be taboo.
It's supposed to be, everything is taboo. You have to be perfect, but you're not supposed to do anything. And even with sex, we're not supposed to enjoy sex, we're not supposed to talk about sex, we're not supposed to, and it's like the world of not supposed to.
Correct.
But that's what's leading us to have disease. And that, and I, when I say disease, I mean, split the word up, dis-ease. You know, so you having an issue with being comfortable with. And so that's where it's starting, and we need to stop that. We need to get together. I know that you brought another picture too, and this one actually, what's this one about? Is this the breast as well, or we're going down into the torso? And
Yeah, we're looking into the abdominal region. And you know, your breast health is completely dependent on your digestive system. So if you think as a woman that you can have healthy breasts and you're not taking care of your gut or your mouth, you're so far off track. You're completely off track. So we have to look at the gut. And in that particular picture, you can see all the little red spots throughout the abdomen.
oh, right down here.
All these little red.
Yeah.
Yeah. That's all inflammation, but that pattern is actually a parasite pattern. So this person
Oh, you could tell that.
has a parasitic involvement in her digestive system. Now, does she feel it?
No.
No, she may have gas, bloating, constipation. And then when I ask her, well, you know, do you feel it? No. I said, but wait a minute, you just told me that you have gas, bloating, and constipation. That's not normal. You think because you've had that through your whole life that's normal. That is not normal. Those are signs of sickness, dis-ease. So,
Which is another reason why you should be in tune with your body. Even
Yeah.
if you're touching your breasts or your stomach or
Yeah, well, there's
your,
a
That's
whole-
what she
your
recommends.
genitals or anything.
Rubbing and massaging
The abdomen.
your abdomen too.
Actually, yeah.
So are you the one that shows them? Because I know sometimes, like if somebody has lymphedema, you have to be careful how you massage the breast and how far the fluid goes, and the same thing probably with an inflamed ovary. So are you the first person, once they come to you and they find out they have all this inflammation, do you teach them how to massage?
I have videos, and I
Oh,
do
that's
spend
good.
time with patients that need to learn and understand. But if they're in the cancer system, because it is a system, then that should be their healthcare practitioner teaching them that. I work with prevention. So if someone is in the cancer system, I'm not going to show them something different from what their doctor or physical
And-
therapist is going to recommend, only because it's a liability. And if they're working with a certain practitioner, they need to see it through. When they're done with that practitioner, that's a different story.
And I can, you know, from my own personal experience, I've never been told anything about massage or anything
Yeah.
else. I mean, I've gone through where I, you know, every night I kind of walk my fingers across my breast and I walk my fingers
Yeah.
underneath, and I'm like, okay, you're supposed to have feeling here. 'Cause
Yes,
I'm still
you're
very
still
numb.
healing.
So,
Yeah.
and I just do it, and I just walk across and walk up and down, you know, and it's like, don't forget.
Right.
You know, I mean, it's still numb right
Wake
now.
up, wake
but
up.
yes, wake up. You know, remember that they're supposed to be feeling here. And I think, you know, my doctor's never talked about that. I did ask him once, and I said, hey, should I be like touching myself? And you know,
Yeah.
he gets all red in the face, and I'm like, am I supposed to feel myself up, you know? And he
Yes.
goes, oh, okay, yeah, you can touch yourself, and you know, and make sure that you're feeling something, because I was told I wasn't going to have any feeling whatsoever
Yeah.
in my right breast, because that's where my cancer was. And so I'm thinking, well, you know, feel me up now.
Yeah.
I think they don't know about
Stimulate
that.
Yes,
yourself.
but it's one of the things. I mean, you're not doing it in a sexual way. You're just doing it to
Yeah.
awake. It's the same thing that you do, like if you hurt your wrists or something else. You know, you're playing with it, you're touching it, you're moving
Right.
your fingers. So you should do the rest of it to your
waking
body.
it up.
Tammy, I had another question on this.
Yeah.
So let's say this was a picture of me.
Okay.
and I had breast cancer. So the color, let's say over here, what would you have seen? If
Well,
you
that is
had-
breast cancer.
So that's breast cancer.
That
Even
is
though
breast-
there's not white, there's more red.
There's red.
Okay.
There's a lot of red. And that is a completely different breast from the one next to it.
Right.
So those should match.
Okay.
Those breasts should match in temperature and in pattern. And, you know, they don't. But when you see heat around the nipple like that,
Yeah.
that's a
Over
problem.
there? Okay.
That's, you know.
And you said something about white, that white was even more, and this one shows it a little bit better.
Yeah.
Where you have the white, so the white is even worse?
Yeah. So here's what's interesting, because when I do it, this is a digestive image. The focus is here, but if the white pops up here, then that's really intense lymphatic congestion, because I'm not even focusing on this area the way I am here. So this person has severe lymphatic congestion in the armpits, which will lead to a disease process if it's chronic and it's not dealt with.
And so when you do see this, is there a way of reversing this? Can this be reversed? Can we start
Lymphatic?
Yes.
Yeah, absolutely.
Cleaning the lymph nodes, cleaning the just
Well,
your
let's
body
just
in
start
general.
with
So-
exercise.
Well, I mean, is this now, once you
So-
find someone
Yeah.
with this problem, now are you the one to go to steer them in the right
Yes.
direction of what they should be doing
Yes.
to alleviate that problem?
Yes, part of what I do once we get their images is we sit down and we do a full review. We review everything that Dr. Melvin, who's the reading doctor, has reported on. And then so everything that he reports on is explained, and then there's guidelines and recommendations that they can follow to change the process.
And you mentioned exercise.
Yeah.
So, you know, you don't have to run to the gym or anything like that, but
No.
but just walking.
You can do
just-
5 minutes of a rebounder, a little tiny trampoline to move your lymph. That's actually one of the best ways.
So that's that jumping up and down motion to
On
get your
the,
body
on a little
to,
rebounder.
Wait,
yeah.
do you do it with a bra
No,
or without a bra?
Without a bra.
Without a bra.
Without a bra.
Oh.
Otherwise, what's the use?
You know, I heard that the tribes in Africa, you know, the women, a lot of them in the, I guess in the villages, they go without bras.
Yeah.
And there isn't that much breast cancer there, from what I read.
Our
you
bra,
know, so-
our breasts are meant to hold themselves up. If you don't wear a bra, right? Like let's say the tribes in Africa, you develop the proper muscular skeletal system to hold your breasts up, no matter what their size. You develop the back muscles, the shoulder muscles, the pecs naturally, because you're not wearing a bra. When you start wearing a bra, you've just taken the job of the muscular skeletal system away. Now you actually end up with back problems and shoulder problems because you're depending on the straps to hold up the breast.
right, and then you also have that underwire that's messing
Yeah.
you up as well.
I mean, if we want to talk about nature, no, bras are not natural. They're not. They're
Okay.
a sling that was devised by a man.
by a man.
You know, but the thing of it is
You want a perky breast.
well, yeah,
But your
it's
breasts are supposed to drop anyway as you get older, aren't they?
Yeah,
Or,
yeah,
Or
I mean-
if you keep fit, if you keep healthy,
you
then
develop the
won't.
muscles to hold them. Yeah, so it's a different outlook. And then, you know, there's the whole binding of the breasts. I mean, it's all lymphatic congestion, which is why you need to just
So many women
either
get cancer.
exercise. Yeah, you've got to deal with that.
When you have a blood cancer, then everything would show up white or red throughout the whole body then, since it's going through the blood
Like
system?
You know,
leukemia or something?
it's that's the thing. This isn't what I would call cancer diagnosis technology. The only thing that can truly diagnose cancer is a biopsy, an actual test of the cells. So mammograms, ultrasounds, MRIs, they can't by law say that you have cancer. They're assessment tools. So thermography is one of the top assessment tools when it comes to learning about your inflammatory pathways, your stagnation, your digestion. So I'm not going to say that we can diagnose cancer with this. What I am going to say is we can figure out where you're blocked, where your inflammation is, where your nervous system isn't functioning properly, and then we take it from there.
And so it's good to know that, you know, this doesn't necessarily mean that it's cancer just because you're inflamed.
No.
It means that you have some kind of disease, not it's dis,
Yes, ease, correct.
you know, and so there's something going on, and
Right.
we need to correct that before it turns worse,
Yeah.
before before it goes, to the south side of
Yeah.
things. Also, the piece of, you had mentioned that we bounce and we move and we do exercise, and I know. When you're just out of breast cancer surgery, any kind of bouncing, any kind of,
Yeah.
leaning forward is painful as hell.
Yeah.
So, but we can still walk or
Yes,
or just
absolutely.
just walk the little fingers across
Yeah.
the breast, so that this way you're just reminding it, and
Yep.
you're also stimulating the muscles and the nerves and
The blood
such
flow.
as well, right?
Yeah.
Because you're saying, tap tap, wake up, wake up, wake up.
Any surgery site, anything on your body, yeah.
Right. Now, the cost, do you find it low, medium, high for the cost of this test?
You know, I feel like it's very affordable based on everything that you're getting from this test. The information is priceless. You're getting a look into your body, and you're getting guidance, and you're getting, I mean, I have email support, you know, videos, it goes on and on with what we do. So,
And I guess maybe not so much the cost, and I know that was one of the questions that came up for me, because
Yeah.
as a patient, you're constantly spending money
Sure.
for medication, for gauze pads, for, you know, for bras. I don't know how
Good
much money I
food.
spend in bras. For food, for everything else. And so I guess, you know, you always look at, well, will the insurance, you know, will someone's insurance pay for this, or is it an out-of-pocket cost?
it's usually
they
out
have.
of pocket.
It's out of pocket,
Yeah.
okay.
So it's out of network, out
Yeah.
of,
Yeah. And what
Okay.
would be the difference between your scanning with your machine compared to a PET scan?
Well, there's no radiation with this. So there's no radiation, there's no body contact, which means there's no pain or compression.
so it's not like in the mammograms
Oh,
where
yeah.
they squish your breast.
Yeah.
And you mentioned, before you continue, I wanted to just touch on that point.
Yeah.
Because I remember reading on your website that the compressions from the mammograms, and not to scare anyone, but that can also cause harm.
Yeah.
Because you're squishing so hard. Because I know I'm supposed to be going in for a mammogram. I'm going, no,
You're not
you'll,
ready
you'll
for that.
blow
No
me up.
way.
Yeah.
But
It's delicate tissue.
it's very delicate.
And if you do have a tumor, depending on what's going on with that tumor, you could squeeze it and then it will spread. So that's a problem. But the radiation is a big problem. It's cumulative.
Yeah, because I have to go every 6 months for new scans.
Yeah.
You know, and
So-
the reality is it takes 8 years for a tumor to calcify. So what's the purpose? It's their system. That's the purpose.
Is it, all right, so
And,
then
and
it's, okay,
their
I'm sorry.
system, explain their system. What do you mean by that?
It's an industry, it's a business, it's billions of dollars, and their system only relies pretty much on mammograms.
Which I can't detect immediately.
No,
so
it
you have
takes
to have something.
8 years to, okay, maybe if we want to say 6 years, but it's you know,
It's
six
a
to 8 years
process.
before that cancer cell calcifies. And you know, and now you have to go every 6 months for what? You
And I
just
have to
didn't you
go
just have it removed? I mean,
Yes,
do you
I
see what I'm
did.
saying?
Yeah.
So
That makes sense.
Interesting.
So it's not a frightening procedure because you're, what are you,
Not at
standing,
all.
laying down?
it's a cold room. You have to acclimate to the temperature. That's the worst part. You're just chilly. It's a dark room, so it's comfortable. It's just the technician and the patient. And you're in a gown, and then eventually you take the gown off. And a breast imaging takes 5 minutes. You're in and you're out. It's painless. Full body, maybe 20 minutes. And you're moving in different poses. You're sitting, you're standing. But it's very comfortable. So easy to do.
And it's just running it over your body. Just
It's like
the
taking
camera
pictures.
taking internal. So we're not actually seeing we're not seeing your face or anything like that. We're just seeing
Well,
like
it depends.
this where it's the
It depends.
pictures.
I do face shots also.
Okay.
So you can't see your face.
No, I mean, like, we're not seeing your face like you are right now. We're seeing more of these colors. That's what we're seeing.
What, you mean the patient? The
When you're
patient
taking
can
the
see
picture of the
patient
person.
can see their body on the screen if they're facing that way, but my back is to the patient. So they're behind me.
Okay, I'm not explaining myself.
Yeah.
So it's not like taking a picture and you see Charlie with her brown eyes and her black hair and stuff. You're seeing
No, this is what
you're
you see.
seeing is you're seeing the thermal
The temperature, the
the
heat.
temperature of
Yes.
the person.
That's what you see. You see
So-
colors.
So you can, so this is John. And John has all this. And so you can see in different areas, right? So when you do a full body scan,
We're moving
start-
to all the different body parts.
so you can also see the back area.
Yeah.
And I remember you said you wanted to talk something about the back.
So this is interesting. You know, we look at the spine, we look at the muscular skeletal system, but here you can see all these little spots all down here. That is again a parasite pattern that's coming from the gut. So it's interesting. You pick up different things when you do different body parts.
And explain to me, because I'm sitting here going parasite, so I'm thinking aliens. you know, like the
Yeah.
movie, The Alien.
Yeah,
and
yeah.
So when you say parasites, is that they have some kind of an infection or some kind of parasite in their
intestines.
in their intestines,
Yeah.
and bacteria or
Yeah.
whatever that's
They have
coming out?
a dysbiosis. They have an overgrowth of, in other words, their microbiome is not balanced. The parasites are taking over.
But does it come from, let's say, bad water, salmonella, or some kind
Food,
of foods or whatever?
yeah,
Oh.
you know,
So that's why you should be eating healthy
well,
instead of processed food and junk food. and-
but see, parasites can come from fruits and vegetables if they're not washed properly, or you know, people who prepare food and they don't wash their hands. There's all kinds of ways that you can
that
get
you can
that.
get that.
When you do a scan like this for a man, will it show prostate problems, or you don't go that low?
No,
don't know.
I
Oh,
do
you
testicular screenings.
Oh.
We do look at the prostate, so you will see some inflammation there if it's present, and they never really know. So it's a great early detection device, and then they can start working on their toxicity, because inflammation really is about toxins.
Right. And how long would it be if someone calls for an appointment? How long would they have to wait? Week, 2 weeks, 3 weeks?
It depends on my schedule. I have another technician, so you know, you could get in the next day if you wanted. It just depends. Yeah.
Just not today. 'Cause she's
Yeah,
with us.
exactly.
And then how fast are the results once the person scans?
About a week. I
About a
give it a
week.
week, yeah, and then and then at that week point, we set up our phone review and we go through everything.
And at that point, you would be the one to tell them, okay, now you need to see a nutritionist or something like that?
Yeah, either myself or the other technician.
Oh,
Yeah,
okay.
we guide them through it.
And do you also do nutrition with them, or do you refer them out to someone to
Well,
do the nutrition?
Nutrition can be hours of conversation because it's really a unique topic. So I'll give them the basics. These foods are inflammatory. These foods are not. You eat the ones that are anti-inflammatory, and that's the very basics. And then if they need a nutritionist, I refer them. Types of inflammation. There's chronic inflammation, which is toxicity. There's acute inflammation because you injured yourself or you had a surgery, and so the inflammation is there to help you heal.
And so I'm being told we're out of time.
Too bad.
I know. So this
fast.
was like a wonderful discussion here. So
Yeah.
we're going to have to ask Tammy to come to another show and talk about inflammation and talk about a little more about what we can eat and what we shouldn't eat and what's wonderful for us to eat.